What's good, y'all? This is Doug E. Fresh coming at you live and direct. All of y'all out there, I got a couple of things I want to talk to y'all about. Wash your hands, everybody. And everybody, what's good, y'all? Wash your hands. 20 seconds. Come on, wash your hands, everybody. And everybody, wash your hands. My people uptown, wash your hands. My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands.
First and foremost, please take your time, wash. Use a lot of soap from the front to the back to the front, and the hook where you at. That's exactly what we want. If you decide to leave, please take heed. Talking social distance, at least 6 feet. Take bus or train, ride in the car. The further you're away, then the better off you are. 20 seconds where you at. That's exactly what we want. Wash your hands like you never ever please take heed. Talking social distance, try to wait to make the great mistake. You need to wash your ride in the car. The further you're away, then the better off you are. 20 seconds where you at. That's exactly what we want. Wash your hands like you never ever please take heed. 20 seconds social distance.
Good evening, everybody, and welcome to the Town Hall meeting on COVID. Please welcome Acting President Brian Bonner.
Good evening, everybody. Welcome to this evening's conversation on COVID-19. Tonight, you will hear from a panel of doctors from the Medical Care Services Division of the county's Health and Human Services Agency. And they are also at the forefront of the fight against COVID-19 here in San Diego County. My name is Brian Bonner, and I'm the acting president of the NAACP San Diego branch. Our NAACP branch is fortunate to have Dr. Jerome Robinson as its health committee chair. He is a highly respected cardiologist who has given untold hours of his time to respond to the COVID-19 pandemic. Many of you may not know this, but every Tuesday morning, he gives an update on the status of COVID-19 to the Black Men and Women United meeting. And he has done this for the last 2 years. I would like to turn this meeting over to him so he can introduce our panelists for this evening and get this town hall started.
Thank you, President Bonner. Greetings, everyone. Glad that you can attend this meeting. We have a dynamite team of doctors on the county end of things, and I'm going to introduce them. We have Dr. Jennifer Tudor, who's a Deputy Chief Medical Officer, County of San Diego Health and Human Services Agency. She is the lead healthcare sector for outreach and education for COVID-19 response. In her department is Dr. Kelly Modadell. She is Child Health Officer, County of San Diego Health and Human Services Agency. And Dr. Sayon. And Dr. Sayon, please say your last name, please.
Ihaloli Pavan.
Okay, and I'm not going to try to pronounce that. But Dr. Sayon has been with us before. Some of you may recognize him. But he is Public Health Medical Officer, Justice Involved Health, County of San Diego Health and Human Services Agency. And he was here with our last town hall we did. So he's an old friend and a veteran of these presentations. But tonight, what we're going to try to do, because there are many questions that exist out there among the public. When I'm out in the public, people ask me questions that we know there are answers out there, but the answers just don't seem to get down to the general public. We're going to try to address that issue, and this team that we're bringing to you tonight is just dynamite. They do this presentation for the healthcare sector. That means the doctors, nurses, physician's assistant, nurse practitioners, every other Thursday. And they've been doing it since COVID onset. When we were in the midst of it during the first part of this epidemic, they were doing it every Thursday. So it's great to have them with us tonight because they definitely have some great information. So without further ado, I'm going to introduce our first speaker, which I've already done, and that's Dr. Sayon T. I'm not going to try to pronounce the last name.
Thank you, Dr. Robinson. And I know Junalie is starting the slide, so thank you again, everyone. We really appreciate having the time to talk to you directly. We are here to engage. We're open to questions, and I know we'll be answering a lot, and we're more than happy to share these slides afterwards. So I'll start, and then I'm going to hand it off to my wonderful colleagues and friends after that. So this slide really talks about where are we as a nation, right? We knew that we were going through this Delta strain or Delta variant in the late summer, fall, and then around Thanksgiving, many of us heard on the news that there was this new variant that had all these mutations and was more transmissible from South Africa, or first detected in South Africa and on the African continent. And so here you see on this picture on the left, if you follow the red line, that's the number of cases in the US that have been reported. Thank you. And so you see that this goes back to July. So the first hump or bump is the Delta strain and that surge, which honestly looks like nothing, like minimal compared to this huge red peak that you see more lately, right? And so that line is over 300% more cases than what we saw earlier at the end of last year. So we see that this is definitely more contagious. Many of you know this, who feel this. We know a lot more people in our communities, in our lives, who have been affected more recently. You may have heard a statistic that about a quarter of all of the cases in the whole United States during the whole pandemic have been within the last month or so. And that may even be an underestimate, because some people are not testing. Some people are doing home tests that are not being reported, which is fine to do that, but it doesn't get reported. So couple things I want to point out on this figure is that you see at a national level, the red line goes up and down. So it has peaked, or it seems to have peaked, but that doesn't mean that it's peaked everywhere. We'll talk about San Diego data. And then when you talk about a peak, just like if you're going up a mountain, you got to come back down that mountain, right? There's two sides to every peak, and we are still having extremely high levels of COVID across the country, and that's definitely in San Diego. Then looking at the orange line, which is hospitalizations, a lot of people think this is not as big a deal because Omicron is less severe. And that is true that it is less severe, but that doesn't mean that it's not severe. Just because something is milder doesn't mean that it's mild. When you infect so many more people, then, then a lot of those people, even if it's a smaller proportion, there's still going to be a lot of people who get severe outcomes. And so you see this orange line for the country is higher than it was for the Delta peak. So you see it's higher on the right than on the left. And so that shows you, and that there's more people hospitalized as a country, as a nation right now. That's a little different in San Diego, and I'll point that out. And then I also want to say that people are still dying of COVID and Omicron, particularly those who are not vaccinated. And we're reporting less than 2,000 deaths a day in the country. Okay. If you can advance. So the main points is that really we've been here before, and we know this is the dominant variant. We know it's more contagious, it's less severe, but it's still straining our healthcare system. So we still have to take action. We know that this variant can evade some vaccine effectiveness and even some treatments, which Dr. Jen will talk about, but that doesn't mean that they're all ineffective, and that does not mean that we shouldn't get vaccinated or boosted. So next, if you can advance once more, really what we could do is, if you are not vaccinated, get vaccinated. If you are not boosted and you're eligible, get boosted. Being boosted for Omicron makes such a big difference because the vaccines are a little less effective against Omicron. Every shot counts. So getting that third dose or that boosted dose really is helpful against getting the infection, and then most importantly, in my opinion, getting hospitalized or getting a severe outcome. Okay, definitely also upgrade your masks, avoid large gatherings if possible. If you're going to meet up with other people, try to do that outdoors in a smaller setting. And then if you are sick, stay home, get tested. If you're exposed, get tested. And if you test positive, call your doctor and let them know. Okay, next slide. And that was what I call kind of the money slide, the last slide. That has the main key points that the takeaway. If you're going to take anything away from anything that I say, it's really what was on that last slide. So here's how we're doing in San Diego. You see right here that our cases every week since the beginning of the pandemic, and you just see that huge surge at the end on the right compared to all the prior surges last winter and even Delta. So we're much higher in terms of cases. Next slide. Then when we look at hospitals, though, it's a little bit of a different story. And that's, thankfully, because Omicron is milder and because people who are vaccinated and particularly boosted are well protected against getting into the hospital, right? So we're seeing a surge in hospitalizations, definitely way more than we saw during the Delta variant, which is the last kind of surge you see before that. But on the rightmost, you see that it's still not as high of a peak as you see last winter, which is that big one right under the kind of the title words. And so because of that, that is definitely, in my opinion, a reason to be thankful that we have vaccines and many of our treatments that we have, and those are being effective. But again, the hospital systems are strained, right? And they're juggling a lot of priorities, and we want to make sure we're minimizing our risks of getting hospitalized. Next slide. So this is, every week we put out in our COVID watch these figures, and I know there's a lot going on here, but the dotted line, just to look at the picture, shows you when you look at the rate and the average hospitalization rate of the whole county overall of people getting hospitalized, and you see over time, and you see those numbers have been increasing in recent weeks due to Omicron. But then when you separate that into the line above and below that, the orange and the dotted line, dotted green line, you see that there's a little bit of a difference. Actually, I'd say a big difference. And you see the bottom line is that the main point, I should say, not the bottom line, it's the top line. The orange line shows you that those who are not fully vaccinated are more likely to get hospitalized than those in the dotted green line who are fully vaccinated. And you actually see that the hospitalization rate is about 2 times higher for those not fully vaccinated. Now, what we're going to be doing in the future, we haven't done it yet, but we're going to be looking not just at whether you're fully vaccinated or not, but actually if you're boosted or not. And we know that being boosted makes a difference. We know that in the general science and the literature and what our hospitals are telling us, but we want to kind of put that in here because I'm sure that difference will be even greater when you look at people who are up to date with their vaccines, including a booster if they're eligible versus not up to date. Next slide. And so what can we do and how are we doing on vaccines, right? So just like with everything, there's always different ways to slice the pie and look at our data and see where are the health disparities. One way to look at it is by age. And I just really, really want to encourage you all to think and talk to anyone who has families, who has kids, grandkids, nephews, nieces, especially. And I know Dr. Modadel will specifically talk about children, but you see that in the 5 to 11-year-old age group, we're really lacking in terms of vaccine rates. And you see here that 22.9 or 23% around, are fully vaccinated. So that's a very, very low proportion of those who are eligible. And so we really need to boost those numbers. And then we need to maximize, of course, all of the other age groups. And we know that, the younger you are, the less likely in general that you're going to be fully vaccinated. But we've done a great job with the 12 to 17-year-olds. We've done a great job, I would say, in most categories, but there's room to improve for sure in the lower age categories, and especially the 5 to 11-year-olds. And Dr. Modadel will expand on why. Next slide. Okay, and this is when we look at it by race, ethnicity. So I've shared a version of this, one of the last times we talked, and this is just the updated slide. And unfortunately, that trend of American, Indian, Alaska Natives, and Black African American San Diegans still continues to hold that, those racial ethnic groups are the lowest vaccinated groups. And that's important because as a group, right, we don't want people to be more vulnerable, right? We don't want people that if a variant comes into a group and affects a certain race ethnic group, we don't want some folks to have more severe outcomes. And it's particularly important because we know when we look at a lot of people of color and minority groups, we know that these two groups in particular, as well as Hispanic and Latino, have more underlying conditions, and which can lead to more severe outcomes or more likelihood of being hospitalized if you do get COVID. Next slide. And so this is a good example. I know, I apologize because I know it's really small on one slide, but on the top is age-adjusted rates of cases for the whole pandemic by race ethnicity. And on the bottom in the green is the age-adjusted rates of hospitalizations by race ethnicity for the whole pandemic. And I just highlighted the white and black rows here that you see here. And the bottom line, in my opinion, is that you can, I crunched the numbers and everything, and you could see that, Black or African-American San Diegans are about 1.2 times more likely to get infected with COVID than white San Diegans. But then if you look at the bottom, they're over 2 times more likely to be hospitalized. So what does that mean, and what explains that disparity? It's probably a few things, but one thing is definitely what I said before, is that, if you're less vaccinated, if you have a group of folks who are less vaccinated and may have more underlying conditions, then they may have more severe outcomes. And we're seeing that in real life here, where you see that, African-American San Diegans are more likely to get hospitalized, and much more likely than they are to be a case compared to white San Diegans, sorry. Next slide. And then these next 2 slides are just, there's a lot of changes lately in terms of the guidance on the national level and the CDC. So I was just going to close with this. We know it's confusing, and Dr. Tudor had a great idea to visualize some of these changes. So we took the CDC guidance on isolation and quarantine, is on the next slide, and just visualized it because, we've heard that, you should isolate for 10 days in the past, and then around the holidays, the winter holidays, CDC did change that guidance down to 5 days for certain people. So this kind of helps you walk through what may apply to you or your family if you do know someone who got COVID. And you see there's a difference based on whether you're symptomatic and whether you're able to do a test at day 5 or later. And so either way, you should isolate. Of course, if you test positive for COVID, you should definitely isolate. But whether you do isolate for 5 days or 10 days depends on whether you have access to testing. So if you have access to testing on day 5 or later, you could do a test. And if that is negative, then you can end your isolation early. The data that the CDC shared shows that about 30% of folks probably will still be contagious at that day 5. And that's why that test is critical. The CDC did not require the test at day 5, but then the state of California does. So we definitely go with that, and we definitely recommend that. And also antigen testing is recommended because PCRs can stay positive for a while, even if you don't have COVID that's contagious. And we see that in some other diseases too, like tuberculosis. So hopefully this helps. And then, and it is important that even after the 5 days, if you do test out of isolation or quarantine, that you continue to wear a mask and distance yourself from others as much as possible. Okay. And then I'll just leave this here. I know just out of time, I'll move on to I'll give back to you, Dr. Robinson. Is that okay?
Well, thank you, Dr. Seon. You got us started, and I'm sure some of this data is data that hopefully folks can think about, take home, and act upon. Our next speaker is a speaker that I'm sure all of you are going to love because many of you have our caretakers, our parents, or our folks who supervise children. And Dr. Motadel is going to tell us a little bit about the child perspective in terms of COVID, what it means for you, what it means for your kids, and what's going on in San Diego County. Dr. Motadel?
Thank you so much, Dr. Robinson, and thank you all for having us here this evening. This is, of course, as a pediatrician, where my heart lies in helping you understand how COVID is impacting your children and other young loved ones that you have in your lives, and what you can do to best protect them through this. So let's go to the next slide. And we're going to start by just taking that overview of what is COVID doing in our nation to our children. So this is results that come out weekly from the American Academy of Pediatrics. That's sort of our governing body for pediatricians. And as you can see, this last week, we had over 1 million cases of COVID-19 in children and teens alone. And how does that really compare? Well, this is the highest numbers we've seen since the pandemic began. It's actually a 5 times increase from just about a month and a half ago. So the numbers have just gone up and up and up in children in particular since the beginning of December. So those graphs that Dr. Seon was showing you previously look very similar when we look at children as well. 10% of all the cases during the pandemic that have occurred in kids occurred just in the last week. So over 2 years, but 10% of the cases happened just in the last week, and that's just really phenomenal. And you saw the graph that he shared about vaccination rates, and he was right. I am going to talk about that because we are not seeing enough of our young ones vaccinated, unfortunately, and we do know that that is protective against them getting COVID as well. So nationally, about 20% of 5 to 11-year-olds have been fully vaccinated. You saw our numbers were a little bit better here in San Diego, just under 23%. Just 55% of 12 to 17-year-olds nationally have been fully vaccinated against COVID. Again, our numbers look definitely better than that in San Diego, which is great. But when you look at 5 to 11-year-olds, we're almost 3 months into them being eligible for vaccines. They are probably about 1/3 to 1/2 the number of 5 to 11-year-olds vaccinated 3 months in as there were when 12 to 17-year-olds were approved. So we're not doing as well at vaccinating our elementary school kids as we did our middle school and high school kids, and we do need to do better there. Next slide. So these are local numbers. These are numbers out of Rady Children's Hospital that they shared with me from their physician town hall that they have, and the numbers are really, really tiny, and don't worry about looking at the specifics. It's really the big picture trend. And so these surges, these bumps are similar to the graph that Dr. Seon shared with you, but we really just want to highlight kind of how this compares now to where we were last winter, which was the other highest surge we saw in children. And you can see we're significantly higher than we were a year ago when we were worried about our kids going back to school or not. So the numbers have increased. It's not just outpatients. There are kids being hospitalized with it too. So if you see the little yellow tips at the top of each bar graph, that represents the kids that are in the hospital. And that is concerning that is more and more visible as you go through the graph. To the farther the right that you go, the more kids you see are being hospitalized as well. So it's not that Omicron is necessarily more severe than it was Delta for the kids, but because of these large number of kids, over 1 million kids in the country, but certainly a lot of kids here in San Diego that are being infected, more of them are going to end up hospitalized as well. Next slide. When they do end up hospitalized, we have some pretty good data now coming out about what it means for them, who's being hospitalized, and what is happening when they're in the hospital. So, there is a lot of people who want you to believe that COVID doesn't affect kids, that it's not serious in kids. It has. So I've heard folks say, there's 0 effects in kids or almost no effects in kids, but you'll see here that's not necessarily the case. Unfortunately, kids and teens do also get hospitalized. These are a couple of studies that look specifically at children and teens. And of the kids that were hospitalized, over half of them needed help breathing. About 1/3 of them were placed in intensive care. What was really, I think, an important take-home point is it's not just kids with underlying conditions who are hospitalized. Otherwise healthy kids are also being hospitalized with COVID. It's not a big percentage of kids who get sick. About anywhere between 1 in 1,000 and 1 in 500 kids who get COVID end up in the hospital, but that's still a lot when you're talking about 1 million kids that have had COVID, right? So 1/3 of kids hospitalized had no underlying health conditions, nothing. Of those that did have what we keep hearing on the news as underlying health conditions or comorbidities, these were otherwise sick kids. Well, that can mean a lot of things. And in this case, almost 1/3 of the kids who were reported as having an underlying condition just had obesity. And we know that we have a big problem with obesity in children. So this is a lot of children that are technically at higher risk. And it's actually one of the biggest risks for kids to be hospitalized is if they are overweight or obese. Asthma was the other one, and we know, and I can speak for myself, my son has asthma, and he is at higher risk for being hospitalized. Asthma is another very common condition in children. 16% of those who had an underlying condition had asthma. So these are not rare diseases. These are not diseases we think of as, not my child or not someone I know. These are people you know, as well as healthy children, people you know that are being hospitalized. But the good news is vaccination was protective in kids. So in both of these studies, a very small percentage of the kids that were hospitalized were kids that had been fully vaccinated. So only 4% in one study, 0.4% in the other study of the kids hospitalized had been fully vaccinated, indicating the vaccine was anywhere from 94 to 98% protective against hospitalization or ICU care. So there is definitely some good evidence we have now on a way to protect our children from more serious disease. Next slide. Other things that COVID can do to our kids, though, even if they're not hospitalized, they can end up with other complications. So this is a complication you may have heard of called multi-system inflammatory syndrome in children, or MIS-C, sometimes called MIS-C. And this is a condition that actually can happen in kids who have had otherwise very mild cases of COVID. Sometimes they didn't even know they had COVID. They had no symptoms at all. And they don't even realize they had it until a few weeks later when this condition comes on. This condition is a serious enough condition that the majority of kids, 96% of kids that get this, end up in the hospital. They're not necessarily counted in the COVID numbers you see in hospital because this is about 3 to 4 weeks after they would have been sick with COVID. There's been over 6,000 cases nationwide. We've had 90 cases here in San Diego alone just at Rady's, not counting some of the other hospitals that hospitalize children. Nationwide, 55 kids have died. This is a disease of younger kids, average age of 9. These are school-age kids who end up with this condition. And unfortunately, like we've seen with much of the pandemic, Black non-Hispanic children are one of the higher affected demographics for this disease. They have a higher proportion of MIS-C than we would expect in the population for what they represent. So this is another condition that I think we probably haven't really talked enough about as being a complication that we see in children. We do see it in adults, but very, very rarely. It's really more in line with a complication for pediatrics. Next slide. And even if you don't get something serious that ends up with being in the hospital, we do still see long COVID in kids. So there's been a lot in the news about long COVID, mostly focusing on adults who have symptoms several weeks after they've had the original diagnosis of COVID. It's estimated up to 10% of kids also have this long COVID or post-COVID condition where they experience fatigue, shortness of breath, muscle aches, or sleep disturbances 2 to 3 months after they were first diagnosed. There's been studies that have actually documented physiological changes several months after they were diagnosed, such as abnormal lung function, or their heart rate not going up as much as you would expect with exercise, or having low iron stores or anemia several months after they were diagnosed. So these are not conditions that are necessarily going to put them in the numbers, put them in the data for being hospitalized or having severe disease, but we all know that these things can be very disruptive to their lives and can be cause our kids to be suffering. Next slide. And then this is something else to bring to your attention, which is really a slide intended to make you think that there's other things COVID may be doing that we just don't know a lot about yet. And so this is a study that came out looking at the fact that kids who had had COVID had a higher risk of being diagnosed with a new onset diabetes within a few months, of more than 30 days after having been diagnosed. So they looked at kids, thousands of kids, and looked at new onset of diabetes. These were doctors who generally saw kids when they were first diagnosed with diabetes, and they thought, gosh, it feels like we're seeing a lot more of this lately. They went back and looked through charts, thousands and thousands of charts across the country, and recognized that indeed there is a higher incidence of diabetes after having had COVID. 116% more than there is with other viruses, which we do see sometimes diabetes come on after having had other respiratory viruses, but this was increased even beyond that. Now, this is just one study, and we don't know for sure that COVID caused it, but there is a correlation there. And again, just I'm using this as a reminder that COVID is probably doing other things to us that we just don't know enough about yet. And for our kids who are still growing and hopefully thriving, this could be a big impact. Next slide. So what can we do to protect our kids? So we talked a little bit about vaccines before, but let's talk about some other mitigation measures, masking. And so we know that there are some folks who think masks are not good for our children. We do not have data to support that, but we do have data to support that it protects them. So this is just one of many studies that has been published looking at how masks are protective of kids in school. This was a study that was done last summer, looking at schools that had mask requirements versus schools that did not have mask requirements, and showed that in the schools that did not have mask requirements, there was 3.5 times the number of COVID-19 outbreaks in those schools than the schools that were requiring masks. And this was requiring masks on both students and teachers. And so this is something that we can do for our children that's simple. Most kids that I've taken care of or my colleagues have taken care of really don't have a problem wearing the mask. I think the families are more concerned about it than the kids actually are concerned about it. They can do really well. It does not obstruct their breathing, and it is protective when worn correctly. We also have had studies also identifying that kids, littler kids, is not impacting their ability to detect facial and emotions from adults. They're actually really good at doing that, even when adults are masked. So this is definitely something we can be doing consistently to help protect our children. Next slide. And then vaccines. We talked about some of the data that we know about how it can reduce effects of severe outcomes, but this is actually showing you the safety behind vaccines, specifically in that 5 to 11-year-old age group where we aren't seeing enough kids vaccinated just yet. But there has been over 8.5 million vaccines given in 5 to 11-year-olds, and this was actually put out a little over a month ago, so there's even more than that now, hopefully. And they pretty much had the same kind of side effects that we saw in adults: pain on the arm, redness on the arm, feeling a little fatigued, or having a headache for a day or two. Very mild side effects. There is, of course, the question probably in a lot of your minds about, well, what about that heart condition that I've heard about can happen after the Pfizer or Moderna vaccine? There were very few cases reported. Those that were investigated were all mild. Some of them weren't actual cases of myocarditis or that heart inflammation. But they've recovered with things as simple as ibuprofen. So this is not a serious condition post-vaccine. Myocarditis can be scary, but after vaccine, the myocarditis we've been seeing has not been scary. I think that's the take-home message, whereas myocarditis is something we see with MIS-C that we talked about before, as well as with COVID, and those kids are often hospitalized and quite sick. After a vaccine, that's not the case. Next slide. So, and vaccines have been shown to be protective specifically against the MIS-C syndrome that we talked about before. The study showed that after having had the vaccine, you had a 91% reduced risk of getting MIS-C, even if you had a breakthrough infection. So again, vaccine can help protect you from the disease. It can help protect you from being hospitalized or in the ICU. It can also help protect you from some of these long-term complications that we're seeing in people who've had COVID in this age group. Next slide. So bottom line for my portion is really focusing on the fact that it is safe to keep your kids in school. It is safe for us to keep these schools open. So schools had actually had limited transmission in the schools. We, of course, are seeing a lot of cases in school-age children. The schools, if you talk to any school right now, they're being very overwhelmed with the number of cases they're having to report. But cases are typically not because they got them in the school. They're bringing them in from outside, from their outside lives, their outside activities, and then being diagnosed in the schools. There are some outbreaks in school, but when we look at the data, schools actually typically have about the same percentage of COVID as there is in that same community, and sometimes a lower rate of infection. So keeping the schools open, we actually believe to be safer for our kids, especially when there are these mitigation measures put into place, such as having good ventilation. Schools are actually much better at enforcing masking than most parents probably are. I know my kids listen to their teacher better than they listen to me on just pretty much anything. So certainly masking as well. And also schools are really paying attention to symptoms. So, if a kid has a sniffle, the schools are much more quick to kind of pick up on it and get the child tested than we might otherwise be if they were just at home with us. It's also really important for their social emotional health. We know that that has suffered during the pandemic. There's actually been a national declaration of a mental health crisis for children because we know that this pandemic has been tough on everyone, but especially our children. Being in school allows them to see their friends and develop those social skills, but also keeps them more physically active. Unfortunately, we saw a big rise in obesity and weight gain during the pandemic, particularly when schools were closed. And then parents need it for their sanity, I think, right? But there's actually a study that showed that that was true, that the parents' perception of their children's behavior was improved when children were in-person learning. So yes, it is safe to keep them open, and it's definitely important to keep our kids in in-person school. And with that, I will pass it back to Dr. Robinson.
Well, Kelly, that was a fantastic presentation. One of the things I know, you do see kids and you get questions from the mothers. What are the most frequent questions that they ask you?
You know, parents really want to know what's safe. So when we're talking about vaccines, they want to know about the safety of the vaccine, what they can expect. Is it worth any risks that they feel for the benefit? And so we go over these same numbers that we just talked about this evening, about the safety of the vaccine, about the minimal side effects, and about the fact that it truly is protective for their kids. They also want to know what they can do, else they can do to keep their kids safe. So we talk about masking and make sure they have a well-fitting mask and know the situations in which they need to use it outside of school as well.
Well, that was fantastic. One of the things I'm impressed with, I listened to Dr. Paul Offit, who's the infectious disease chief at Children's Hospital in Philadelphia. And he's also on the advisory board for the CDC and the FDA. One of the things he said that absolutely breaks his heart is when he makes rounds, and he's making rounds in the intensive care unit, to see these young kids on vents with multiple tubes in, struggling to survive, which can be prevented. Uh, you know, I don't know how else one would be able to get that across unless you could actually see a visual picture of it. How do you do explaining that?
You know, pediatricians have been giving vaccines for, centuries, decades at least, right? So we have seen preventable diseases from vaccines our whole career that end up, happening and making kids quite sick and sometimes killing children if they had gotten the vaccine, that wouldn't have been the case. So we talk about how this is another one of those vaccines, really. People worry about, well, was it rushed and the wasn't good safety? And I reassure them that this vaccine went through every step of approval and of safety and of clinical trials that any other vaccine has been through. There was just a lot more collaboration and funding and volunteers that helped it get through that process more quickly. So this is a safe vaccine. And we talk about, how it would feel if not getting that vaccine and then your child getting sick, how you would feel about that. We also talk about the fact that getting children vaccinated is not just to protect the child, although that is certainly benefit enough, but how would a child feel about bringing that disease home and infecting one of their loved ones? We know that hundreds of thousands of children have lost a caregiver during this pandemic, and no child wants to be responsible for that in their own home.
That's so true. We have some questions coming up. And which age group had the highest incidence of diabetes post-COVID?
So that study was done on 12 to 18-year-olds specifically. So it didn't necessarily look at kids younger than that. It was focused directly in on 12 to 18-year-olds, and I don't have the breakdown of the ages within that.
Another question that comes up, and I'm sure parents are quite concerned about this, is are we going to need another shot? Is this going to be like the flu? How often is it going to be?
Yeah, I don't have a crystal ball, so we don't know that for sure. We do know that most vaccines do take more than 1 or 2 doses. If you look back on your child's vaccine card, you'll see that most of the shots they got had 3, sometimes 4 or 5 doses, with all those extra boosters needed through the years. And so I think that the fact that we're seeing the need for boosters, at least in our adults and our older kids at this point, is not surprising to us pediatricians at all. And whether it becomes an annual vaccine need or not, I think some of that will depend on how well people are protecting during these next few variants that we'll see and the next surges that we see, and we'll just know more with time.
Another question, and that is, since this was most of the studies are done now in the 12 to 15 and older group, uh, what about the kids who are younger? And what about this long COVID syndrome, particularly with brain fog?
Yeah, so long COVID we're seeing across all age groups. We have an easier time detecting symptomatology or symptoms in kids that are older and can be verbal. So we don't have as much information on the younger kids, but we do know that long COVID happens in across the age range. It's not just in adults, it's not just in older kids, it is also in younger kids as well. And the brain fog that's described is also described in some children. We see it more often in kids that have had severe COVID. So there were some studies that have recently come out looking at kids and adults that were in ICU settings that had, very specific neurological defects afterwards, including, this idea of brain fog. But it is also happening in kids who had mild illness.
One question that I have, and that is, I know that they have a risk score that they use at Johns Hopkins, probably for the adult population. Do we have a risk score for children to tell which of those children who get infected are going to be seriously ill, require a ventilator, and or die?
We don't have a specific risk score. We do know what risk factors make that more likely, but as we saw, even healthy kids are getting hospitalized, and healthy kids have also died from COVID.
Well, that's good. So fantastic. We're going to move on to my long-term friend, and don't tell him how long, Jen. It'll age both of us. So Dr. Jennifer Tudor is the head of this section that gives us the data every other Thursday now, and a longtime friend. And so without further ado, Dr. Jennifer Tudor.
Thank you so very much, Dr. Robinson, and thank you everyone for supporting the meeting that we're all having with you today. Special thanks to Julie Ventanilla, who is advancing our slides, and our webmaster, and then all those wonderful text and information with the links that is going in your chat box is due to Erica Hernandez, and a ton of work from everyone on the team for the slides today. So just wanted to take a moment to thank everyone, as well as all of my colleagues, because really with COVID, it absolutely takes a village, and it's so important for all of us during this pandemic to keep taking care of each other. So expressing a lot of gratitude to everyone here today. I am going to, I guess if I were fourth, I would be the cleanup hitter, but I'm third, so I don't know what I am in this ball game. But my topics are test, treatment, and vaccines. So I'll be doing a little bit of each of these topics that I know that Dr. Sayone and Dr. Modell have already touched upon. Really exciting news is that the COVID-19 self-test are now eligible for test per address, per household. And I have already gotten mine. So through the US Postal Service, they're around here somewhere. I don't know if you can see this, but I got my box here. So I have gotten mine. The orders are shipping pretty quickly, and those are free. And definitely there's additional information for those folks who are in a congregate care setting, like a skilled nursing facility or something like that, where people can have their separate addresses and get that information, get those free kits. So please, if you haven't already, sign up to get those free at-home COVID-19 tests, and those are the rapid antigen tests. So if we go to the next slide, please. The tests are working against Omicron. There are two tests that the FDA has identified that don't work very well. And those are on this link that we provided, because as we always say, information about COVID could change by the time that we finish this talk. So throughout the presentation and the talk we're doing with you all today, we want to make sure that you have those links, and so that you can look up the information a week from now or 2 weeks from now and get the most up-to-date information. The important thing, like Dr. Sayone said, is if you test positive for COVID-19 and you're having COVID symptoms, you don't need to go to a testing center and repeat the test. You don't need to go to the emergency department or make a doctor's appointment to repeat the test. If you need medical care or emergent medical care, then by all means, but otherwise, call your doctor, let them know what's going on, or your healthcare provider. But if you test positive at home, go ahead and isolate. And I think of I for infection, so isolate, whereas quarantine is you've gotten exposed to something. But if you have symptoms, even if you can't get a test and you have COVID symptoms, or you've been around someone with COVID and you're having symptoms, then you do want to isolate at home and follow those guidelines to prevent giving it to someone else. And those are the guidelines that Dr. Sayon showed earlier today. If you test negative at home, but you have symptoms, or you've been exposed to someone, then you still should isolate and call your doctor or healthcare provider for more information. So if you test negative, but you're showing the symptoms of having COVID, or maybe you've been exposed to someone and aren't really sure how to read the test, definitely want to talk to your healthcare provider and make sure. And as I said, if you have any emergency signs, you want to seek emergency care at the emergency department. So that could be trouble breathing or chest pain or really high fever that you can't control with medications. Then you want to make sure that you seek emergency care. So next slide, please, is just a little bit on how to read these tests. So when you're using these rapid antigen tests or the home test, usually if you read the directions, there'll be a time that says you can read the test at this time. We have the example here of the Binax Now. Generally, if you don't mind circling that Binax Now on the right, that's our example directions here. But that test, for example, say you can read the test as early as 15 minutes, but then you can wait, or the full time would be 30 minutes. And so if your test reads positive at that minimum amount of time, in this case, 15 minutes, you're positive, you're done. You don't need to watch that test any longer. But at 15 minutes, if your test reads negative, or the minimum amount of time, then you should wait that full time according to that test, in this case, 30 minutes, and read it again at that full time. If it's still negative at that full time, test is negative. But if that test is turned positive between the minimum time and the full time, then you take that positive result. If you're looking 3 hours later or 5 days later, you don't want to read it past that maximum or that full time. But this really helps make sure that you're reading the test appropriately, carefully, and that we're picking up on any true positives. So if we can go to the next slide, please. You can also find free testing at any of these locations. So this is the county's website for testing. You can find testing sites by location. You can find them by the day of the week. So the testing schedule, which is my personal favorite of looking to see, oh, today, where do I need an appointment? Where can I walk in? And then where are those testing locations? And then there are other testing options that are on this webpage. So like pharmacies or community health centers, clinics, other organizations offering those free COVID tests. And you can even get them at Kaiser, even if you're not a Kaiser patient. So there are lots of different options in our county to get a free test. The county testing site locations do the PCR test, so they aren't the instant test results. And other ones will tell you which testing they are doing. So if we go to the next slide, please, testing options are with your healthcare provider or your clinic. They can be with the county testing sites, and then community testing events. And I know Dr. Aflalo, who I think I saw on this call, has been doing an amazing work with a lot of community testing events, but so many people are doing this work. There's so many testing events that are available. And so urge you just to look at the website and find where that test location is, because if you think you need to test, if you've been exposed, if you have symptoms, or even if you're coming back from travel, all of those guidelines that recommend testing, then it's important to get that done both to protect yourself and those around you. So my next topic is vaccinations. And vaccinations are also available at many healthcare providers, many county vaccination sites, and then community vaccination events. And with healthcare providers, I'm including our pharmacies as well. So if we go to the next slide, please. Booster doses are a type of vaccine. So we have this a little later in some of our slides, but when we say people are fully vaccinated, that means they've either had 2 shots of their primary series, if it's Moderna or Pfizer vaccine, or that you've had 1 shot of your Johnson & Johnson vaccine. So that is your primary series. So that is, if you are fully vaccinated, then that's really, really important. But like Dr. Kelly and Dr. Sayon have been saying, if you have that booster vaccine, you're even more protected. And so that booster vaccine is the vaccine that you either get 5 months after your Pfizer or your Moderna shot, or 2 months after your Johnson & Johnson shot. And it's right now only been given emergency use authorization for people 12 and older. So we talk about being up to date with your vaccines if you have your booster, if you're eligible for it. So those people who are up to date have had their booster, if they're 12 and up, and it's been 5 months or more from their Pfizer or Moderna, or 2 months or more from their Johnson & Johnson. It's not easy to keep up with it all, but the goal is for you to be totally up to date on your vaccines and have everything that's been recommended to protect you the most. So next slide, please. And this is a slide that literally just came out after about 5 o'clock today. And so we have put it in this, created a new slide. And so the link is here, but research released from the Center for Disease Control, or CDC, shows that the boosters are effective at preventing severe illness and hospitalization. So this study that was released covered both the time that Delta was happening as well as the Omicron happening. And getting this 3rd vaccine, or the booster, showed to be more effective against preventing emergency department and urgent care encounters. And it was more effective against preventing hospitalizations. And so that's really important to know that both for Delta and Omicron times, the booster helps prevent emergency department visits, prevent urgent care visits, and help prevent hospitalizations. So if you look at San Diego, and I just pulled this data this evening, there have been 25,552 boosters given to the 143,625 Black or African Americans who are 12 and up living in San Diego. So doing the math, that's at about a 17% of people who are 12 and up who are African Americans here in San Diego have gotten that booster shot. Now, I can't tell you if all those folks were eligible, like if it's been 5 months since their last vaccine, but that is the percentage of people who have gotten the booster. So when you look up above that, it's like 80 and 90% effective about decreasing that risk of getting serious illness, we really want to get more people boosted. And then in San Diego County, this also was just released today in our county news center, that 9.1%, or 91 of the San Diegans who were hospitalized from December 14th to January 12th, only 9.1% were boosted, and the rest were not. And so really, really important. Certainly more people were in the hospital who were fully vaccinated than not fully vaccinated, but people who were up to date on their vaccines, who were boosted, less of those people, less than 10% of all of our hospitalizations were comprised of those folks. So if you go to the next slide, please, Junalee. We want to encourage folks to have safer behavior, safer activities, so that you can make the choices that are right to your family. If you have kiddos under 5 who can't be vaccinated because of their age, or people who live with you who are immunocompromised or older or have other risks, then your behavior and your risk tolerance may be different than other folks. So you want to do what's best for you using the information and the science that we have. So you can see this array of the low risk activities and the high risk activities. We've certainly talked about the vaccinations, we've talked about the masking, and we've talked about being outdoors, not in crowded settings. And then if you need to be indoors, having that ventilation. So all of those are really important things. So next slide, please. And I'm going to go on to the treatment. So if you do get COVID, and many people are getting COVID, 6,000 new cases just today alone. So if you do get COVID, we really want people to understand what treatment options there are for them, especially with the mild to moderate cases where you have symptoms, but you're not sick enough to be in the hospital. And we want people to know about these because the treatments help prevent the risk of people being hospitalized. So one of the antiviral pills that's just come out that is approved for emergency use authorization is called Paxlovid. That's the one on the left. And that one helped reduce the risk of hospitalization by 88% in people who are at high risk for having serious outcomes of COVID, compared to people who just took a sugar pill or a placebo. It does interact with several medications, including heart medicines. So all the pills need to be prescribed by your health provider and need to be dispensed by a pharmacy. So Paxlovid, 88% relative risk reduction of hospitalization and mortality or of dying of COVID in those people. So the important thing for both the Paxlovid and the molnupiravir is that both of these pills need to be given within 5 days of onset of symptoms. So that's why the testing is so important. If you're at high risk and you have symptoms, then you want to get tested, whether it's at home with your home test or with a PCR test, to make sure if you are positive that you can then advocate for yourself and get these medications if you're eligible. The molnupiravir was a little disappointing. It's a 30% relative risk reduction, still helpful to keep you out of the hospital, but it's hard to compare that 30% to the 88%. And it is not recommended, just this molnupiravir is not recommended in women who are pregnant or men who are planning to start families in the next 3 months. So the next slide, please. Other treatments are the monoclonal antibodies, and you've probably heard about these. There are 2 types of monoclonal antibodies that work against Omicron. So 2 different monoclonal antibodies. One is sotrovimab, and that is the one on the left that works to treat people who are positive. It has an almost 80% relative risk reduction of people ending up in the hospital or of dying of COVID. It's also for people who are at high risk and who have moderate or mild symptoms. They're not in the hospital, but they're symptomatic. The monoclonal antibody, this one can be given up to 10 days after symptoms start, but it's way better to give it as early as possible. Or I shouldn't say way better, but studies are showing, just like the flu medication, that it appears to work better the earlier you take it. Now, the pre-exposure prevention, this Evusheld is just for people who are at really, really high risk because they are autoimmune. They can't mount an immune response or a protective response, or may not be able to take the vaccine because they've had a really severe side effect after they took the vaccine. These are people who are transplant patients or people who are getting chemotherapy or bone marrow transplants, who really are not able to be out and about because they can't get vaccinated or the vaccine isn't working. And so this Evusheld is available at transplant centers and oncology centers at some of our hospitals here in San Diego. This one has a 77% risk reduction in preventing people from getting COVID symptoms. I'll go to the next slide. I see some chats here. And actually, I think is this our one more? Okay. And so the message that we have is, obviously, if you have symptoms, get tested and first contact your healthcare provider, your physician, to determine if you meet the criteria for getting the sotrovimab. Obviously, if you're a transplant patient or you're getting chemotherapy or you have a very severe immunocompromising disease, you want to talk to your provider before you get COVID, before you get exposed, to see if the Evusheld might be right for you. But this slide of the monoclonal antibodies is just specific to the sotrovimab. And so you can call after talking to your healthcare provider, making sure that you're eligible. And if the medications, the monoclonal antibodies, aren't available in your health system, then you can call that number, the 619-685-2500, and you can make an appointment and go ahead and get the monoclonal antibodies at these different regional centers. So they're in many of our different neighborhoods. We have several sites all the way from Vista down to Chula Vista. And what's really important is making sure that you are sure that you're eligible, and then calling these sites if you need treatment. It is not a blood product, so it's a protein made in the lab. It is infused, so sotrovimab is infused over 30 minutes in an IV in your vein. You're watched an hour to make sure everything's okay after the IV, and then you're done. That's it. And then if you're in a skilled nursing facility, there's a contact information there, and ready to email with any questions as well. And so these centers are open 7 days a week among the different centers that we have right now. So next slide. So don't forget to, besides everything else we've been talking about with COVID, is to live well, to take care of yourself, to take care of others. And so you can be part of our Live Well team and protecting yourself by making great decisions for yourself as well. So trying to eat healthy and getting enough sleep, being physically active, reducing stress, and managing underlying conditions. I don't think any of these things are easy. I don't think any of them are any easier during the pandemic. And I really wish there were things I could say other than try to get enough sleep and make healthy food choices, and call 211 if you need help with access to food, and try to set a regular schedule to get enough sleep. Those sound pretty trite. Unfortunately, they work, and they're really true. And so they're just other ways that we can take care of ourselves. Sometimes I try to tell myself messages as if I were one of my best friends. So it's easier for me to tell a friend, hey, go ahead and, pick that apple, you can do it, or get out and walk, it'll make you feel better. It's easier for me to tell a friend that if they call for advice than to tell myself. So sometimes I just try to treat myself as I would treat my best friend. And sometimes, that's all we can do. So that is what I have. Oh, I'm so sorry. I have one more slide, and that is, besides helping and supporting each other, there are lots of sectors out here in the county that are set up to protect, to support, to help all of our community partners. So we've got one for businesses, childcare services, cities and governments, faith-based organizations, community-based organizations, schools, older adults, veterans, long-term care, all kinds of groups. And so each one, like us, has a web page and is really here to serve the public and to do what we can to help all of us get through this really tough time of the pandemic. So Dr. Robinson, that's what I have to you. I'm going to turn it back over to you.
Well, Jennifer Tudor, you were spectacular as usual, and you can be the third person, or that person that's going to hit the home run every single time. There are a couple questions I have, and one of the things I know that you guys are inundated with calls about who is eligible and what separates those who have mild to moderate disease, so that they understand, and who has worse than that. Can you talk about mild to moderate disease? How is that defined, and what risk factors put them in the high risk category?
Sure, but I'll also, I think any of us can answer those questions. So I'll start, and then Dr. Modadel or Dr. Sayone, I will open to you all. The easiest way to define mild is that you got a little bit of symptoms. It's not stopping you from doing anything. So you might have a headache, you might have a little more fatigue than normal. You might have a runny nose or a sore throat. Just a little bit of symptoms. It doesn't need to be severe. It doesn't need to stop you from doing what you would normally do, but those are usually the mild symptoms. The moderate symptoms are those that you're really noticing a little more. You may actually just want to rest for the day, but you're not needing hospitalization. It's not to the point where you can't catch your breath, or you're really feeling short of breath, or you can't control the pain of your headache, or something like that. And then clinically, one of the things that helps us separate between the moderate and the severe cases is what people's oxygen level is. So people can have those little oxygen monitors, or the O2 sat is kind of what we call it. You put it on your finger and it beeps out your pulse, and then it may say 98%. If it says if it says 94% or more, then we know that you're in the moderate or mild phase. But if you are at like 93% or 90% or 89, then that puts you into the severe COVID phase. And definitely if you're hospitalized for COVID, or if you're needing oxygen for COVID, then these monoclonal antibodies aren't for you, because those are indications of more severe disease. So I don't know, Dr. Modadel or Dr. Sayon, you want to add anything to that?
Yeah, I thought you did a wonderful job, Dr. Tudor. I just wanted to say that, again, as Jen mentioned earlier, really, if you're not sure, and this is really why it's so important, if you test positive, to connect with your healthcare provider, right? And this is also a larger, I think, one ask from us really, and as a society, is that we hope that everyone has a medical home, right? And this is a great excuse or opportunity to make sure that you have a medical home, right? Whether it's a community clinic, a private practice, whatever. But as long as you're connected to someone who knows your health history, whether it's COVID or something else, that they can guide you through your health issues. Over.
There are a couple questions I'm going to ask, and then I'm going to open it up.
Oh, do you want me to answer the second part of the question? So sorry, I did one
Sure,
part
ahead.
at a time. Okay,
I
think your second part of the question was, how do you know if you're eligible for monoclonal antibodies, or if you're at high risk, or even if you're eligible for the pills, the antiviral pills like Paxlovid, because both of those are for people who are at higher risk of having bad outcomes from COVID. And so those risk factors are things like being 65 and older, being pregnant, being obese or overweight, having diabetes or chronic kidney disease, high blood pressure or heart disease. Oh my goodness, look at Junalee. That's exactly what I'm reading from. Thank you. See, I told you, it takes this whole team. They're like way ahead of things. This is our webpage, and maybe Erica, if you wouldn't mind putting the link to this. But this is a web page, and so I'm just reading on these dot points. Heart disease, I think I said like high blood pressure, or chronic lung disease. It wouldn't be like mild asthma in the adults. It wouldn't be things like mild asthma that maybe once or twice a year you need a little puffer for, but it would be people who have lung disease that they need medications every day for. And then race and ethnicity are risk factors. And those are things that we certainly see, as Dr. Sayon already showed, that have a disproportionate effect of COVID, or I should say COVID has a disproportionate effect in San Diego, depending on your race and ethnicity. So a high risk factor may indeed be people who are African American or Black. Right now, unfortunately, we have a really, really small supply of Paxlovid, as well as Evusheld and Sotrovimab. So it is really tough to have enough of the medication for the people with these very high case numbers every day, the people that meet those eligibility criteria. And so from there, then we're going to these NIH treatment guidelines to help us in an objective way prioritize who is at highest risk and therefore would need these medications or would and would get those first. And so we have them very transparently on the website. This is the website for our health providers, and we have the same information on our website for the public there. But hopefully I answered that question. Sorry if I went on too long.
No, you perfect. Both of you and Kelly, you're both parents, and I want you to speak to the role of women in increasing vaccination rates. Specifically, the U.S. Department of Labor, women make up 80% of the healthcare decisions in the family. Thus, women caregivers are in a unique position to ensure family members receive appropriate vaccines and recommendations from the CDC. So, would you two like to enlarge upon that? Your mothers, you got children, and what do you do, and what do you tell folks who are coming in to see you, who are also mothers and children, and how do you address all of those issues? I know that's a big one, but I'll give it to you anyway.
I will try first, and then I will certainly let Dr. Jen take over as well. So thank you for that question. That's certainly not an easy question to answer, but I think, we know that women, as far as their careers and their workload burden at home and at work, has been dramatically impacted by the pandemic. We know that it's been really hard to homeschool your children or semi-homeschool your children while trying to work from home, and now with children still under the age of 5 not eligible for vaccination, that childcare has been very hard to come by because cases in the preschool classroom can close that classroom down for 10 days or more. And this is a really hard impact. So I think as a mom, that is one of the first things I sort of try to relate to. How has the pandemic impacted you personally, and sort of talk about all those ways that sometimes we aren't even thinking about. When you first say that to someone, they might just be thinking about the person they know that had it, or did anyone in their family have it. But if you really look at all the different ways it's impacted them and their children, it can really drive home the importance of trying to find a way to the other side and kind of doing our part, each of us in this together, to do our part to get there.
Jen, you want to add on to that?
I think that was a beautiful answer. I'll just give warning to Dr. Sayon, since he's a parent of 2 beautiful and bright daughters as well. So I don't think you get out of this one, Dr. Sayon. I think what you said, Kelly, is really important. I think all I can really speak to is me as a mom. And for my kiddos, the first thing that I thought was that risk benefit of, is it having more benefit to them to get vaccinated, or would it be riskier to them to get vaccinated? And for me, when I have a kiddo with asthma, like Kelly, for me, it was much riskier for them not to be vaccinated than for them to be vaccinated. And so just looking at that data, and that's very true if you look at, the whole population data, right, is that and Sayon has a wonderful slide where it shows how many thousands of lives can be saved for every case of an MIS-C or a reaction to a vaccine or something like that. That usually goes away. And so even though those side effects are really rare in kids, even those rare side effects are much more likely to go away very quickly, and it's more likely to have something bad happen with COVID than it is even with one of those side effects. So that was one of the ways that I just kind of tried to weigh it in my brain of, it's safer for my kids to be vaccinated. And all we want as parents, right, is safety. Now, sometimes it's really hard to make an appointment and it's really hard to get them there. And if you have teenagers like I do, then you have to think, okay, when can they play sports and when can they be in school, and how do you fit it in with their schedules? And then how do you convince them to do it? But some moms might have to convince the other parent to do it, or the grandparent, or whoever is helping to raise those kiddos. And so I think it's important to recognize everyone wants to do what's best for their kiddos. And so trying to get that information, which is really our job, how can we make it really simple for people to understand what is the best decision for safety? And that is often talking to your child's healthcare provider is a really good way of getting information. Now, not everyone has a healthcare provider, and certainly we know that our frontline providers are really, really busy. And so that's why we try to put a bunch of information out there and reduce risk misinformation. And then the last thing I'll say, and this is kind of thinking about me, it's all about me rather than what's safest for my kiddos, is what can I live with? If something happens to them and I made the choice not to vaccinate, can I live with that? And for me, that just wasn't even someplace I wanted to go. And so I think, unfortunately for us here today, we've seen the really tragic outcomes of COVID. And I think once people see that, then it makes it an easier decision for them. But we don't want people to see that in order to make those decisions.
One of the things I want you guys to talk about, and that is we've seen a relatively low rate of mortality in San Diego County as compared with the nation. We know that in the nation, mortality is going up. And I want to ask, do you expect that to occur in this county? And if so, can you explain why it's still, that the vaccine is still working, even though we're seeing cases go down and mortality may go up? You want to address that because people are going to be concerned when they start seeing that, if we see it at all.
Yeah, I can start. We know that mortality is going up. I mean, like what the data that I showed or Dr. Modadell showed with kids, right? When we have this many infections, even something less severe is still going to impact a proportion, even if it's a smaller proportion of that huge number of people who are infected. So unfortunately, we are seeing that just in today, the weekly data dump that was, or the press release that was sent out at probably around 5:30 or 6 right before this meeting. I saw that they reported around 96 deaths, I think I saw. So it's going up, and I know in the US it's going up. So it is something, unfortunately, we have to deal with. But the good news, like you mentioned, Dr. Robinson, is that we in San Diego and California overall, that we've relatively been lower in terms of death rates than many other parts of the country. And that really is due to many factors. One is, more compliance with masking. I went to Arizona the other week, just to visit my family over there, and it's a little bit of a different culture. There's different rules. And then we've had different restrictions or rules that other states may not have had. And then also our vaccination rates are, amongst the highest in Southern California, or are the highest in Southern California, and then amongst the highest in the state. So, and then compared to many parts of the country, our vaccination rates are higher. And that is the success of vaccines. People can look at vaccines and Omicron and think, hey, well, they're not that effective or not as effective. And that may be true in terms of infections, but in terms of severe outcomes, they are still really, really effective. And thank you, Jen, for sharing that recent data that really emphasized that. So that's what's going to be one of our best, protections against avoiding deaths in San Diego County.
There's one question I'm going to ask you guys to answer, and then I'm going to open up the floor for our participants to be able to get on and ask their questions. It says, my wife got the booster and it knocked her off her feet for a day and a half. I don't want to get the booster. It seems like COVID-19 may be winding down, being endemic like flu. I never got the flu shot, and I haven't had the flu in decades. Can I get away with not getting the booster?
Okay, I'll go first. So even though I'm a pediatrician, I've certainly had these sorts of conversations with parents about themselves and with their kids. And there's a couple points I want to make. So first of all, you just saw the data from Dr. Seon about the effectiveness of the booster. And although it may seem scary to know that you might have a day or two of feeling awful, a headache or nauseous or body aches, and maybe be knocked out for a day or two, you know what you're up against. Whereas if you actually get sick, that we can't predict how it will affect you, and it could be much, much worse. So that's the first point I want to make. And the flu shot, I've had probably too many conversations to count over the comment that, well, I've never had the flu, and I've never had the flu shot, so I don't think I need it. And my usual response is congratulations that that's been, that's happened so far. But every year is a lottery, and it's not a lottery you want to win. And so I would say the same thing with COVID at this point. We don't know who's going to get sick. We know who's at risk, but we also know people that aren't at risk have died from COVID as well. And so for me, the risk of having a day of feeling lousy was much more tolerable than risking getting the disease.
Would you like to, last question I'm going to ask, and I'm going to open it up. I said that last time, but this is the last. We know that there's a separation between those who are vaccinated yet not boosted versus those who are vaccinated and boosted. You want to talk about that a little bit?
Dr. Tudor. Yeah, no, I don't know if it's worth bringing up your slide again at the end, but I thought that data were very compelling. I will say that for Omicron, the booster makes more of a difference for Omicron than it did for Delta. And so we are definitely seeing that play out in the data, and we are definitely seeing less breakthrough and, like Dr. Tudor shared, less hospitalizations amongst those who are boosted. I think she shared that it was 9% of or about 1,000 people have been hospitalized in San Diego, and only about 9% of those have been boosted. So it's not bulletproof, quote unquote, but it is extremely effective against severe outcomes.
Okay. I'm going to now open it up for the audience to ask questions, and we'll open it up and see where we are.
They're putting them in.
Oh, where do I see them?
They're giving them to you.
Oh, okay. Oh, here's one. My 98-year-old father-in-law was just taken to Scripps Chula Vista from the veterans home with COVID-19. Not looking good for him, failing kidneys, which means some meds are not indicated. This, if they were using that risk score from Johns Hopkins, I think they would say that he's at the highest risk. You guys want to comment on this?
I'll just say I'm so sorry to hear this. I'm not sure what the question is, but I definitely defer the appropriate treatment and the recommendations to the excellent team at Scripps Chula Vista. I'm so sorry, as we all are. I mean, every person we hear about, we recognize that it's someone's family, someone's grandfather or father or child or neighbor. And but as far as any specific questions about this gentleman, I would defer that to their healthcare team.
One additional comment, folks can raise their hand and we can go live to you. But I'll read one more question that I got. San Diego County includes populations from the Middle East, North Africa, and thousands more from regions that are arriving in San Diego, especially Afghan refugees. But as your county data slides demonstrate, there are no racial ethnic data for these community members. Instead, they're miscategorized as white. When will the county update the racial ethnic data so that it's accurate?
I can start. You're correct that definitely, there's large groups of people when you look at each race, ethnic group. Sorry, I mean, I'm an example, right? I'm even though I'm born in Africa, I'm Sri Lankan, and so I'm part of an Asian category, which is the same as the Chinese population, which is the biggest country in the planet. So, and we clearly have different characteristics and probably health outcomes, et cetera. And so I think where we need to go in the future, of course, is to disaggregate the data even more, break it out even more so we can make more, focused recommendations and guidance, and so we could be aware of each community, because there are disparities within each category. But unfortunately, we do have to defer to we are not the data folks who are creating. I know we're talking about the data, but really we'd have to go back and talk to our epidemiology department in terms of how they're able to get the data, and if they're able to slice it up even more.
Good. Here's another question. Many minority businesses, especially those who don't have or require an office location, have their home address as listed as the business address and utilize a PO box. The system recognizes this. Will all COVID tests ship to the address listed as the business? Is there a way around this feature, or can you provide some suggestions and assistance?
I do know there's a FAQ on the website for when you sign up for the antigen test to be mailed to you. So unless my colleagues know otherwise, I'll take a look at that and we can post that in the chat. If that's helpful.
That would be helpful. Let me see. I think we've gone through some of the other questions that were given. So we can now recognize some people with hand raising on the computer and get them on live.
Well, I'll ask one of the first questions. There's a fear factor for vaccinating our very, very young children. How do we help with that kind of mental anguish, as well as encouraging the young people when they go through it, that whole fear factor of getting the vaccine and not knowing what will happen to them?
Thank you for that question. You know, I think we talk to them about what we do know is the most important thing. So what we do know is that they're going to have a sore arm. And there's ways that we can help them reduce that with using that muscle over the next several hours and next day, that can help reduce it. I think we let them know that they might not feel good. Both my kids have been vaccinated. I have a 10-year-old and an 8-year-old. My son was actually in the Moderna trial, and so we really didn't know too much about what to expect, but we talked about what we did know. We talked about what had happened to mommy and what had happened to daddy, and they had seen us go through that. And then my daughter had her Pfizer the first day it was approved, and we went in and we again talked about, you know, she's had shots before. We compared it to what it would feel like. So I think really just sort of kids want that transparency. They want honest answers. They want to know the reality of the situation, and the reality of the situation is that we've seen it given to almost 9 million or more than 9 million vaccines given in the young kids at this point, and it's been shown to be safe. And so we reassure them about that.
Miss Jackie Clark, your question.
Hi, everyone. I did have a question about the, can you hear me?
Yes, we can hear you.
Hey, Dr. Sayon.
Hey, how you doing?
I'm good. Hi, Dr. Tudor. I've heard so much about you, and it's finally good to put a name to the face, but Sayon, it's good to see you. Dr. Sayon, I'm sorry. So I do have a question. When I think it was Dr. Tudor was talking about the people who had been hospitalized that were vaccinated and boosted. And then there's a population of people who were unvaccinated. So how is the number, what is the difference, or how does the numbers that you reported, how does that impact the numbers that are reported for those two populations? Because I understand that people who are unvaccinated are you're saying are at the greatest risk, but then now you're saying the people who are vaccinated but not boosted are also at great risk. So I was trying to understand that.
That's a great question. I'm so glad you asked it, and that you gave me enough time to pull up the numbers. So thank you. And again, this just came out today, so we're all still kind of deciphering it. But what we are seeing, and this is from January 1st of last year to January 12th of this year, so a tad more than a year. what we're seeing is that, so of all of the hospitalizations, so of all the people that are hospitalized, let me say that a different way. Oh, I just pulled up a totally different chart. Because the data that I said, so see the data that I said was for a different time period than the chart that I pulled up. So let me pull up the county communications article in a second. But to answer your question, you're absolutely right that that people who are vaccinated can still get hospitalized. It's not as likely for vaccinated people to get hospitalized as people who aren't vaccinated. And it's even less likely for people who have been vaccinated and have that booster to get hospitalized. But it is possible for people who are even fully vaccinated with the booster to get hospitalized. It's just not as likely. Okay. So it's kind of like, you know, it is likely to win a lottery ticket. It could be likely. It's a lot more likely if you buy a gazillion tickets than if you only buy one. You could win the lottery with that one ticket. You could be that lucky one. But I'd rather, if you gave me my druthers, I'd rather have a gazillion free lottery tickets and win the lottery than if someone's handing out lottery tickets and say, oh no, I'm good with one. I only need one to win.
Okay, gotcha. Thank you so much.
You're welcome. And it's nice to meet you too.
Mr. Dwayne Hill.
Yes, thank you for this presentation. You guys are in your expertise in the medical field. I feel even more educated by attending this here webinar. My question is that in the testing stage, there is the nose drop that they have, and it says it's even more effective against the Omicron, and also it's cheaper to produce and than the vaccination shot. Is there any later data that you guys have on there? Are you familiar with the nose dropping that is in testing stage? They haven't not quite been approved. Have you guys are aware of that?
I'm not, Mr. Hill. I'm sorry, but usually, I mean, anytime a medicine or new treatment for COVID-19 comes to the FDA, I mean, it makes big news. So once it really gets to that place where FDA is reviewing the data, then usually there's announcements and press releases. So hope, you know, it sounds like there may be potential. We have to wait and see. But you know, the FDA then will dig through the data and then they'll make a recommendation.
Yes, because as of now, you know, say if you have got tested, had gotten your vaccination a year ago, you know, with the Pfizer and Moderna, you know, and you have not gotten boosted, it have dropped down like 30%. And where it was at 90%, now if you boost it, it brings it back up to like 91%. You know, and so the people that's not getting that booster shot, just like my grandson at UC Berkeley, he has been fully vaccinated and boosted, and he tested positive. He's in quarantine right now. You know, he's 18 years old, and he's just really feeling it because he can't get out and eat. You know, they bringing his food and everything. So the Omicron is very effective, even whether you vaccinate and boost it. You know, so but I was looking at some medical data. They have that nose drop, and it says it would stop the Omicron right in its track. I mean, you would not even get the viral load in your nose. So I don't know. I just was wondering if you guys was up on that latest medical news.
So I do know that there are, sorry,
Go ahead.
I do know that there are some pharmaceutical companies that are studying a nasal vaccine, which I suspect is what you were reading about. I don't, as Dr. Sayon said, I'm not aware of any that are in the process of having been already submitted data to the FDA to look for emergency use authorization, but there are other vaccines in development, and some of those are nasal vaccines. So maybe that's some new data that's come out that we'll see more of soon.
That's it. Thank you.
And
Okay.
oh, I'm so sorry. I was going to say two things. One is I'm glad that your grandson, first of all, congratulations on UC Berkeley. That's awesome. And I was going to say that I'm glad he's doing well and can stay in his dorm at least, because again, the booster isn't going to prevent everyone from getting Omicron, but we really want it to prevent people from getting hospitalized and certainly from dying from Omicron. And each new variant that we see, we're just going to have to learn about as we continue to, build all of this information. I mean, now we know every year when the flu comes, how to get a vaccine, we have some medications for it and so forth. So the other thing is I wasn't sure for the nose drops, were you talking about a vaccine or were you talking about once someone has COVID that there's a drop that helps prevent it from multiplying and causing you to be sick?
I believe Dr. Kelly had mentioned the trial basis, the nose of, yes.
And
Okay.
there is, and Dr. Tudor, I just looked up, and there is a San Diego-based company actually that's trying to develop a nose drop or a nose vaccine. So that might be, and that was in the news maybe about a week ago.
Yes, that's it.
10 days ago. So that's probably what you heard about. But it's still early on. I think all these are promising, but we just got to see if they can make it past the finish line before we can recommend it.
And leave it to Sayon to find that 10 News, presentation and be able to really answer your questions. So thank you, Sayon.
Well, I'm going to take a page out of the Millennial books, and they're saying that, look, the vaccine has not been tested and not enough research has been done. And that's the reason why I won't take the vaccine, because there's just too much information that we don't know about the vaccine. Can you address that?
Sure. Oh, good, Kelly. Okay, so I'll start and I'll just say, I'm sorry, that when this vaccine first came out, I 100% sympathize with anyone who had that point of view, who thought that, this is brand new, that, they don't want to be first. Often you don't want to be the first person, and then, and you want to see how it plays out. But I think what some people forget is we had these huge clinical trials. Not only that, but these are the most monitored vaccines in the history of vaccines, right? We've never had such monitoring available. We have now new tools like the V-Safe tool you might have used after you got your shot, to even communicate to the CDC, where they text you every couple of days to see how you're doing. So they're even doing monitoring after you get the shot, not just in the office or in the pharmacy where you're getting the shot. And so these vaccines now have been scaled up, given millions and billions of times, and we know that in the history of vaccines, right, there hasn't really been any long-term effect that has started past around 6 weeks, and that goes back to what Dr. Offit said at the Children's Hospital of Philadelphia. So by now, because we've given so many of them, we've really seen all of the long-term effects, right? And when we're saying a booster, it's the same exact vaccine. The Moderna one is half a dose, but the booster in Pfizer, it's the same exact formulation, everything, right? And so it's not a new vaccine per se. So there's really not surprises now. We actually do have a lot of data, and actually we have more data than we've ever had. So now it's the question that I turn back to other individuals is, what is the one thing holding you back from getting the vaccine? Dr. Motodell, did you want to add anything?
Yeah, I mean, I echo what you say 100%, that those are all excellent points. The other thing I do like to let people know about, because I don't think this was discussed. We heard a lot about warp speed and how quickly it was developed, but we didn't really talk about why it was able to happen so quickly. And so I do like to use an analogy of what I was doing at the beginning of the pandemic. So I was not working at the county at that time. I was working for Vista Community Clinic. I was the chief medical officer and a pediatrician there. And we had probably 2 to 5 years of conversations about having patients do telehealth visits and about our workers working from home. And we'd never been able to implement it because human resources had concerns, or operations had concerns, or ergonomic concerns, or did our patients have the right IT technology at home, and we didn't have the right policies in place. But you know what? Within a week of our crisis, our public health crisis hitting in March of 2020, we had it all figured out. Within 1 week, we had people doing home visits or doing health visits online, and we had people working from home across the board. And how did we do it? The same way we developed a vaccine so quickly. We worked with other companies that had typically been our competitors to develop best practices. What were other people doing? We had those conversations and we collaborated. We received funding that we had never had available to us before in order to develop our technology and develop those policies in the workforce, just like the pharmaceutical companies were receiving funding that they'd never received before. We had done a lot of research previous. We had that 2 to 5 years of conversations where we already had a lot of research built up before we actually needed to make those decisions. Just like we had a lot of science behind mRNA vaccines before we had to make those vaccines. So just like everybody else in March of 2020, when all of our lives changed quickly and we kind of figured out how to do it, the pharmaceutical companies and the scientists were able to get together very quickly to use all their collective knowledge, collective ideas, and collective funding to develop these vaccines, but still go through all the same steps. Never before had we had hundreds of thousands of people lining up to be volunteers for vaccines, but we had that. So we had lots of people available to do these clinical trials that often take a long time just to recruit patients. And then to echo what Dr. Sayone said, we also now have more eyes on this than we've ever had before to make sure we're monitoring it well.
Okay, I got a good question for you, and you might be able to help us out with this. COVID itself. I noticed that the Lysol can that I had 2 years prior to the COVID outbreak said that it protects against COVID. So my question is, has COVID been around for a very long time? In the 2019, this COVID just took off. Can we get some background on when COVID appeared?
I can start. So you might have, Dr. Thompson, if it was 2 years ago before we really knew about COVID-19, COVID stands for coronavirus infectious disease 2019, the year that it was first discovered to affect humans. But before that, there were plenty of coronaviruses, and that's just some of the common colds are due to coronavirus, and so it was probably referencing those coronaviruses that caused the common cold, if it was older than before the pandemic. Since the pandemic, though, if you want to know if the cleaning products you're using are effective against COVID-19, there's actually they have to register with the EPA, the Environmental Protection Agency, and so there's a list, and I can find that and put that in the chat if that's helpful too, right after this.
One thing I might add, and that is, there are two researchers at the University of Pennsylvania who were doing research. At least one of them, a female researcher, was doing research on this in the 90s. And surprisingly, she had applied for grants based on her research and kept getting turned down. She was about to be turned down and turned out at the University of Pennsylvania until she got together with another researcher at the University of Pennsylvania. They then took this research that they had developed to a person at MIT who was big in terms of research, particularly in this area. And she now sits on the board of Moderna. That research in terms of this technology was going on back way back in the 90s. And it just became such that the most important issue was how do we harness this RNA? And you remember the temperatures at which the vaccines had to be deployed to various states and community health clinics and other clinics that were doing the vaccinations. So that that was the rate limiting factor. How do we stabilize messenger RNA? So the research on this was a long time ago. In fact, that those two researchers from the University of Pennsylvania, they won the second highest award, second to the Nobel Prize last year.
Well, here's another great question from Mr. Bonner. It is the flu vaccination, the flu vaccine has a senior dose. Is there a similar senior dose for COVID vaccines?
Not yet. And you're right, Acting Director Bonner, that that was a relatively recent addition to the flu vaccination. Kind of the options is something called Fluzone, and they have a stronger dose for older adults, and that's because a stronger dose will lead to a better immune response in older adults. That so far, at least with the COVID vaccine trials, the immune response was similar across age groups. It was just that those who were severely immunocompromised who did not have a good response. But so I don't even know if there was a need because the mRNA technology is so good at getting a response. But if there is a need, maybe they might pursue that in the future. But right now, there's no talk of having a higher or stronger dose version for older adults. Good question.
All right, Miss Jackie Clark.
Okay, so maybe 4 or 5 days ago, I read some news stories about the CDC had a report that indicated that vaccinated people with a prior case of COVID had a more natural immunity or something like that. I'm gonna try to, hold on one second, I'm gonna read it exactly.
Super immunity, I think you're talking about.
It was like, it said a new study released by the Centers for Disease Control and Prevention found that people who were both vaccinated and had survived a prior bout of COVID-19 were best protected from the infection. And it also went on to say that unvaccinated people who had a prior case of COVID were a close second. And then, of course, things changed after a certain point when the Delta wave wasn't as prominent or something shifted. So I wanted to know, what are your thoughts about natural immunity in either case? I mean, if you can say.
No, I think we should be open and transparent and talk about the science. So I'm gonna pull up. I don't know if Dr. Moderdal, Dr. Tudor, if you want to start, I can pull up. We actually have a slide on that we prepared, not for this talk, but for another talk, which I think is helpful around that study. But I will say, I guess I could start and say, yeah, that study was very interesting. It looked at during the Delta surge, the hospitalizations and cases really, and they broke it out into those unvaccinated and those other groups, like you said. And I think there's no surprise here. The group that is most significantly at risk for any bad outcomes of COVID is people with no immunity, right? These are people who have no vaccine or no natural infection, right? No prior infection. And then when you look at other folks, it is comparable for Delta. And we know that when Delta came, that variant, the vaccine was a little less effective against Delta. So it makes sense versus, the prior strain, that Delta and natural immunity were actually similar in terms of protectiveness. But you really have to remember that natural immunity, when you're talking about people with natural immunity, that's the people who survived, right? We unfortunately, we're in a country that, as in general, us Americans, we're not that healthy. A lot of us not getting that much sleep, a lot of stress in our lives, and a lot of other reasons that we, and social determinants of health and other things. And there have been over 850,000 Americans who died from COVID, right? They haven't gotten that chance to get natural immunity because they passed away from the disease. And we know, I think Kelly talked about this earlier, that vaccines are the safest way to get immunity, right? And yes, there's mild symptoms, and some people may be knocked out for a day or two in terms of just feeling crappy, but still, that's not going to land you in the hospital, right? That these are safe, effective vaccines. And so if I had an option, I would rather, of course, get the vaccine than try to, play the lotto, like Kelly said, and try to get natural immunity. And yes, natural immunity, there is a role of natural immunity. There is some protection, and I think we're learning more and more about it. So I'm glad that CDC published that data. I think they'll be following that more, but it's just really important to know that that's the people who've survived, and that, people who get natural immunity may have long COVID, they may have MIS-C, they may have other issues. They may get new diabetes, like Kelly said, which also is shown in adults. So why take those chances when you can get your immunity through a vaccine?
And thank you for that. And just to follow up on that, what do you recommend that people who have anxiety about getting the vaccine or even getting boosted, to get, how that they say you can get sick, you feel bad or whatever. What do you recommend they do in preparation for that? Like, I know hydration matters all the time, but is there anything else people can do to prepare their body for that? Or, because I've seen everything from everything. So what do you recommend that people could do to help belay those type of symptoms, or satisfy their fears or something?
Go ahead, Jen.
One of the things I was going to say is you're absolutely right, the hydration and rest and everything else. But I see it as a really good sign that your body is responding to the vaccine. So I'm sure, Kelly, when her son was in the trial and she was like, "Ooh, are we getting the placebo or are we getting the real?" It was like, woohoo, his arm hurts. That's so exciting. And so I see it as, and I talk to my kids about this, is, yeah, you're going to have some symptoms, but those aren't side effects of the vaccine. That's showing you that your body is strong and reacting to the vaccine and building up those white blood cells or protection, and kind of revving up your immune system so that when your body sees the COVID virus again, it's going to be all ready to go. So sometimes I just still try to trick my mind of knowing that I want to have some of those symptoms, because that means that my body's really strong and ready, and I'm excited to be getting protection from the COVID vaccine.
Okay.
And I will confirm that Dr. Jen is correct. I was excited that his arm hurt and that he had a little bit of a fever.
All right, so I'm going to ask one of the hard questions. We're having work shortages, meaning that there's not enough people able to get to work because of COVID. So we've seen that the CDC has basically changed some of the quarantine processes. My question is, I know that in certain school districts, they say that if you test positive for COVID, but you really don't have any symptoms, wear a mask and still come to work. Will our children really be safe with that new type of mandate and job planning?
So we have very transparent policies and algorithms. They're called decision trees for both childcare and preschools, as well as one for K through 12 education. And in all of those cases, if you actually are positive with COVID or you have symptoms, it is required that you stay home. You're not allowed to continue at this time in San Diego County in schools, whether you're a teacher or a student, if you are positive or you have symptoms. If you are exposed, there is a possibility that you can now stay in school, and that is new. So previously, if you were exposed, there was initially you had to stay home. Then we had what was called modified quarantine, where you could stay if you and somebody and the person you were exposed to had both been masked and it happened at school. Then you were allowed to stay, but needed some testing. And now there's some additional options depending on whether students are vaccinated or not vaccinated, depending on whether or not the exposure happened at school or didn't happen at school. So if you were exposed and you're fully vaccinated, those kids can stay at school, but they are recommended to get a test on day 5. And if they are not vaccinated, there is now the option for them to stay at school with what's called group notification. So depending on how, if they were just in a room with somebody versus being very close to someone, they may be able to stay in the school, but they do need testing on day 3, 4, or 5. And so thank you, Erica. I was going to ask if you could put the links to the decision trees in the chat, and there it is already for K-12. And you can look there to see exactly what you need to do, depending on the situation, kind of question by question. It'll take you down the tree to see what your options are.
Do we have any other questions from outside? Well, there's lots of questions that you can't answer that I won't answer. I won't ask. We talked about those earlier. But what things do you think we should do to get better vaccination rates in minority populations? Because that's a real stumbling block. I noticed it was only 50 to 55% on your slide, Seon. So how can all of us be able to accomplish what needs to be accomplished? Because as long as we have people that are unvaccinated, the virus can still infect you, it can still replicate, and it can still mutate, and we may come up with new variants of concern.
No, I almost want to turn that question around for our audience, right? And so what are you not seeing in the community that needs to happen to really get the word out there, right? And you talked about, for example, women head of households or women in households really being the lead in terms of healthcare decisions and health literacy and all that. And there's definitely a strong history of females, being more attentive to health and being more, going to healthcare providers earlier when situations arise. And so that was one, group of individuals, of course, who have a lot of influence and are trusted messengers in all communities. But I also, how else can we really get the word out with our trusted messengers? I see Samantha Williams' hand up, and I think this is a perfect opportunity to talk about her work that she does across the community, because she is that trusted messenger, and she will go wherever the need is to deliver a shot. So, and I think she'd be a wonderful person, if it's okay, Dr. Robinson, to help answer.
Sure.
Hi, everyone, and thank you all so much for this wonderful, wonderful presentation. I think it was excellent. This is actually, at least in a while, one of the first presentations I have attended that weren't coming from the medical perspective. So definitely kind of putting that community member hat back on. I felt like the information was just delivered very well, and many of our community members would be extremely receptive to it. And so it almost made me think of, in the sense, if I know we're all really inundated and exhausted from the work we've been doing, but if it were possible to almost do a tour for some of our local schools in targeting, especially those schools that have those under vaccination rates. And if there was a way to even implement some of the community health providers, like from the FQHCs, and I know it means a lot oftentimes when the parents and the children are able to see their actual PCP, presenting or on the call, giving feedback. I know it was mentioned earlier in the call about community members having a medical home. And unfortunately, that's just one of those things that are easier said than done. In our community, it's just not as easy to, if you don't have a PCP, to just sign up and get one, right? That can take weeks to months, and definitely with schedules being inundated. And then oftentimes those relationships aren't able to be quickly established. And so, but for those who do have one, they are extremely important. And so to be able to see their PCP a part of the work that's being done to push vaccination rates and see that they are promoting it, I think it would mean a lot, and as well as seeing the representation of all of us who are working in the community. So if it were possible to do a little miniature tour, even to start with a few select schools and see how that went, I think that would be really beneficial.
That's
Well,
great input, Samantha. We'll take that back because we're of course part of a broader team, and so I'll definitely report that out.
Well, this is the time where we're going to ask all the doctors. First of all, we want to say thank you so much for being a part of this town hall with the San Diego branch of the NAACP. Want to thank Dr. Jerome Robinson for leading this and bringing you all together. We also want to thank the San Diego City College and Dr. Ricky Shabazz, who made this possible with funding this great town hall and the leadership of the NAACP. So we want to thank all of you. And I want to give each doctor final words. And then Dr. Robinson, if you could then take us home.
Chief, Dr. Tudor, you can go first. Ladies before gentlemen.
Okay, well, we'll do the reverse order. So the thing that I would say is I love the idea from Samantha Williams. I know Sayon was writing it down. I could tell Kelly and I were, also writing it down. And really, we want to hear from you all and from all of our communities in San Diego what we can do. Because you know best what is going to help in your community, in your neighborhood, in your school, and in your church. So I would love, if you don't mind, Erica, putting our healthcare sector email address, and we take all recommendations, all questions, all suggestions. We'll put that in the chat box. I think it's mcsdcallcenter.hhsa@sdcounty.ca.gov. Is that right, Erica or Junalie? I probably rattled it off too fast, but
It's in the
Erica,
chat.
pardon me?
I just added it in the chat.
Excellent. I see that as our as mcsdcallcenter.hhsa@sdcounty.ca.gov. So thank you. And you also, again, thought through my mind before I could say it. Our website is there too. So we try to get information out, but also we want to hear from you all what is helpful. I think we've probably said it a million times. We wish we had more options right now. The best thing as far as prevention and reducing your risk of hospitalization and dying from COVID is getting vaccinated, and if you're eligible, boosted. And all of those decisions and different things you can do along the way of wearing a mask and staying outside and everything else like that, staying home if you're sick, asking others, hey, are you sick? Do you have a runny nose? Please don't come over today. Even if we're going to eat in the backyard, please don't come over today. Just protecting each other and protecting ourselves, I think, are so important. Thank you.
Kelly?
Yeah, thank you for the opportunity to be here and talk with you all today. And I would just say, if you still have questions, as Dr. Tudor said, we are more than happy to answer, but we know also that your physician, if you have a medical home, is a great resource and might be a more comfortable place for you to talk about your individual and your child's individual risks and any potential risks, but certainly the benefits of vaccine and other things. And the other thing I would say is remember that throughout this pandemic, it's always been a matter of layers of protection. There's not safe and unsafe. There's different levels of risk. And so if you are in a situation where you can mask, but you can't distance, or you can distance, but you can't mask, all of those things, everything that you can do adds to lowering your risk. And certainly the vaccine is something that we have great data to show that it lowers the risk. But if you have not gotten there yet, or your child is not there yet, there are still lots of other ways to protect them to the best of your ability while you're working through that question for yourself.
Dr. Sayon?
Agree. Thank you again, NAACP San Diego chapter, for letting us be part of this education. And we are learning from you, just like hopefully you're learning from us. And I just wanted to say that as a society, right, we, when we're talking about the advancement of colored people, right, we don't want to be worrying about COVID-19 more than we have to. Right. So the ways that we minimize our risks of COVID-19 is to take these layered interventions and efforts. And so then we can then focus on the other priorities that we really need to get back to, other injustices and other disparities. And so as much as you can, you are all trusted messengers amongst your own circles. So keep doing what you're doing. Hopefully this information helps and gives you the tools and the information. But again, please continue to ask us questions. There's plenty of resources on our website, and give us other ideas, just like Samantha did, on how else we could improve.
Well, I personally want to thank you guys. It's been fantastic. We got, as I would say, news you can use. And this is a lot of take-home stuff for our audience, and hopefully it gets more people vaccinated. Next month is African American History Month, and we have to figure out some ways that we can maybe get to a school or get someplace else where we can give the information that needs to be given so that we can increase what happens in the community. I'm certainly up for it. And with that, I'm going to sign over to our acting president, Mr. Brian Bonner.
I want to say thank you to everybody who participated tonight. The turnout was encouraging to see that there are a lot of people in the community who are very concerned about our health. I particularly want to thank the staff from the Health and Human Services Agency who gave up their time and brought us a tremendous amount of information tonight. And I think it's just important that they have said that they're available to answer further questions, because some of the things that you heard tonight may cause you to come up with more questions, and we do have a place to go to get answers, and I really appreciate that. So on behalf of the NAACP San Diego branch, I want to say thank you to everybody for your participation. And I also want to say good night. And just by way, it's my father-in-law who is sick at Scripps Chula Vista Hospital right now. So
hopefully he does well, Brian.
Well, with that being said, we'll end off like we started, with this song.
Shout out to the hip hop public health. All the healthcare workers on the front line. Together, we can make a difference.
What's good, y'all? This is Doug D. Fresh coming at you live and direct. All of y'all out there, I got a couple of things I want to talk to y'all about. Wash your hands, everybody. And everybody, wash your hands. 20 seconds. Come on, wash your hands, everybody. And everybody, wash your hands. My people uptown, wash your hands. My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands. That's right.
First and foremost, please listen close. Take your time, wash. Use a lot of soap from the front to the back, back to the front. Sing the hook where you at, that's exactly what we want. If you decide to leave, please take heed. Talk a social distance, at least 6 feet. On a bus or the train, riding in your car. The further you're away, then the better off you are. 20 seconds or more. You gotta be able to wash your hands like you never ever washed them before. 20 seconds or more. Try to wait, you'll make the greatest mistake. You need to wash them when you enter the door. 20 seconds or more. Take your time, sing a song, spit a rhyme. When you're finished, you can put on some gloves. 20 seconds or more. It's very important to wash your hands. You're protecting everybody you love.
Wash your hands, everybody. And everybody, wash your hands.
20 seconds.
Come on, wash your hands, everybody. And everybody, wash your hands. People from the Midwest, wash your hands. Dirty South, wash your hands. People overseas, wash your hands. And everybody, wash your hands.
Now if you catch a little fever, shortness.
So again, thank everybody, and a good night from here.
Thank you. Good night.
Thank you. Good night.
Congratulations, Dr. Follow.
Thank you. Good night, everyone.
Bye.